Hi, I'm Elizabeth Wise, the president of Lehigh Valley Hospital Pocono. Your health deserves a partner, and that's where we come in. Each month, we'll bring you different health topics from Lehigh Valley Hospital Pocono experts to help keep you and your family healthy and safe. This month, we'll be hearing from a husband and wife who will share their unique story, Dr. Fuzesi, who's our cardiothoracic surgeon, as well as Dr. Sheikha, who's an interventional cardiologist here at Lehigh Valley Physician Group Pocono. I hope you enjoy the show. Nancy and Edison are husband and wife and never expected to have the same open heart procedure in the same week. When they had the need, we answered the call. Here is their story.
Going to the second floor, that happened again. I can't breathe and I start sweating, and I said, okay, this is the time where I need to go to see the doctor. Very scary moment.
I remember being in a room with a bunch of people with masks around Nancy, and I didn't know who was the nurse, the doctor, or the cleaning lady. Our doctor just looked at me and he said, this is my name, you can Google me, look my hair, it's white. I've been doing this for many years. Your wife's in good hands. That was like a humor moment, and humor sometimes builds bridges.
I think Nancy and Edison is a very good example of a caring couple who is a little unaware of what the community have to offer them. We here in the Pocono have been working for well over 10 years to develop a world-class heart system and provide care that no other hospital in this area can provide.
A big mention to the wonderful nurses.
Oh, yes.
Because the first 24 hours, the nurses didn't move from a room.
Yeah.
They didn't.
One of those, they came every single day, in the morning and the afternoon. You don't see that often. This is my first time where I feel doctor very close to us, worrying about us.
In healthcare, we've shown many times that if you have a caring partner, it's a lot easier to go through a lot of these processes. And obviously, that partnership really pays off huge dividends as they go through the course of their illness.
Well, the whole time, I know he always worrying a lot about me. And so the first day, they asked me, I want to walk. And in my head, I said, I had to walk. I want to tell Eddie, look at me. I'm going through, and you want to go through this too.
Obviously, she was very strong and did very well, and that reassured him as he was approaching his operation that he can get through it also.
It's a very technical operation. It's an open heart. You know, we're in the Pocono. The fact that you guys had that entire program for that was a huge surprise. A great surprise.
We are lucky.
Yeah. And the fact that then she had the operation the same morning, right here.
We do a very important treatment option right now in this part of that disease. We bypass you, or we give you stents, or whatever the options are. But it's very important to beat this disease, to continue to take care of yourself.
All the change we did it together because it was a medical need, plus the emotional support.
When I don't want to walk, he pushed me, let's go.
And when I don't want to walk, he says, no, we need to go for a walk.
Yes.
I think unique here is we also provide to this community services that no other healthcare service provides.
I did have a heart attack. And believe me, the first few minutes, they're kind of critical. Because part of your heart is dying, you know. So a 45-minute ride, you know, down the valley, maybe it's not the best choice.
It's not, you don't have to leave this community. And again, I'm very proud that we've been really developing this system here for well over 10 years, and it's right here for you.
So the fact that you guys saved my wife's life that Tuesday, that's the reason we're here. We don't work for the hospital. We're happy that you guys are here. The Lehigh Valley Hospital is here in Poconos because when we had the need, you guys answered the call.
Nancy and Edison, thank you so much for sharing your touching and emotional experience with us. Coming up next is Dr. Fuzesi, who operated on them, and he'll share his experience as well as a little bit more information about cardiothoracic surgery.
We've seen the concern in your eyes. You're scared, nervous, want to know if it's safe. The answer is yes. At LVHN, you'll see the extraordinary steps we take to get you the care you need safely. At all our facilities, you'll see temperature checks for everyone, that we sanitize every surface, and yes, you'll see that masks are required. What we look forward to seeing is relief in your eyes. Lehigh Valley Health Network. Your health deserves a partner.
Before I became president and CEO of Lehigh Valley Health Network, I was a doctor in the ER. I've pretty much seen it all, so I understand why you may be scared to go to the hospital or see your doctor because of COVID-19. I want to assure you that at LVHN, you will safely get the care you need. We are taking every possible step to keep our ERs, hospitals, and doctors' offices clean and safe. So please, don't neglect your health. Take charge of it and know that at LVHN, you have a partner you deserve.
Joining me now is Lehigh Valley Hospital Pocono's cardiothoracic surgeon, Dr. Laszlo Fuzesi, who helped to save both Edison and Nancy's life. Thank you for joining us, Dr. Fuzesi. And I don't know if you know this, but my background is in cardiac surgery. As a registered nurse, I took care of a lot of cardiac surgery, cardiac transplant patients. So I'm thrilled to be able to talk to you and ask you some questions. So tell me a little bit about your role here.
Well, I'm considered the chief of cardiac surgery, which means that I run the teams that basically take care of all heart illnesses that are related to the heart. That's mainly valve surgery, coronary artery bypass surgery. I also take care of lung illnesses, which really is primary lung cancer. Okay. So my team manages a lot of the surgical problems with lung cancer.
So have you ever encountered such an impactful story like Edison's and Nancy's before? They're really young, and can heart disease affect someone so young?
I never want to say never. I've been doing this for 30 years. Wow. In my early career, I did a lot of transplantation. I had a lot of great stories there. But in 30 years, I've never had this exact scenario where I happened to do the exact same operation on a husband and a wife within 5 days.
Wow.
And that's pretty impactful. Obviously, they're very close. They came to it in different ways. He was much more aware of his problems. He had some previous issues with his heart, as opposed to his wife, who really never thought she had any illness and really came in sort of very shocked that she had such a serious problem. But I always say partnership is really important. Mm-hmm. And in this case, it was so obvious how each one helped each other get through this problem to end up with both having very successful operations, and for both of them to be able to live a lot longer, healthier lives because of it.
Yeah, I agree with you. In my career, I've never had a husband and wife so close together, you know, having the same procedure.
Right.
So we're really blessed that you're here with us. So is there a certain age or demographic that we should start paying particular close attention for heart issues? And there might be differences between men and women, maybe?
Absolutely. I think there's no real magic formula. Unfortunately, we see some very young patients as well as elderly. In general, heart disease becomes more prevalent as you get older, but there's no black and white there. And I think clearly, I always say, if you're fortunate enough to know your parents, apples don't fall far from trees. So if you happen to have a lot of heart disease in your family, if both your parents had heart disease, clearly you got to be worrying about it at a much younger age. But what we've really learned a lot about heart disease is good surveillance pays off immensely. So basic cholesterol testing, basic blood pressure testing, basic seeing your primary doctor and your cardiologist, they know exactly what to do. So if you're pretty careful about it, even at a young age, you should start thinking about it. But if you have a real strong family history or some comorbidities like diabetes and smoking, even at a young age, 40 years old, you should start at least thinking about it.
And many people are staying inside now. They should really be, if they can, if the weather's nice, get out and exercise and take a walk. Prior to this summer, neither Nancy nor Edison had experienced any heart issues. What are the warning signs and symptoms that you should keep an eye out for?
I think most people know the classic signs of, chest pain, chest pressure, but heart disease doesn't always present that way. There's a lot of subtle signs, and sometimes they are asymptomatic. So there are things like shortness of breath, chest pain, or pains that aren't typically in the center of the chest, jaw pain, that are also signs. But sometimes it's as simple as fatigue or just not feeling, your normal self. So again, I think you have to think about everything, but more important, make sure you see your doctor, make sure you do your regular checkups, because your physicians are pretty aware of all the things that they should be looking for. But it's not always a classic, I'm having crushing chest pain.
So having open heart surgery can be really scary, right? And people could be anxious. What are some things that you do to help ease the anxiety or fear or concerns that people have about having open heart surgery?
Well, again, I'm privileged to have been doing it for 30 years, which means I've sort of lived through the golden age of heart surgery, and I understand where we were when I started this profession and where we are now. So I could really let my patients know that we've come a long, long way. We don't worry about things as mortality as much anymore because we don't really lose patients that often. We also have learned how quickly we should be moving patients along, getting them out of bed, getting them up, getting them walking. So that experience really helps me sort of ease their concern. Everybody always says good luck, and I say I don't need luck in the operating room. We know what we're doing, and we really have learned so much. And we're pretty fortunate here. Our patients tend to do really well. We have a really isolated, focused group of a team. And so our patients are really up and about very quickly, usually the first morning, and many patients are home in 3 or 4 days. So if you could ease those concerns, I think people usually are pretty as comfortable as one can be when you go in this kind of major operation.
Yeah, you mentioned a couple things. One is the team aspect. So we're very fortunate that we have a lot of team members with a lot of experience. So you can, certainly relay that to patients as well. Why is maintaining a healthy heart so important, and what are the lifestyle changes people can make to keep their heart healthy?
Well, I always tell patients that we don't cure heart disease. Unfortunately, once you have heart disease, you have heart disease. So, we can do so much on our end. Obviously, we have a lot of interventions that really can help prolong your life, but almost as important, if not more important, is to try to match your lifestyle to a healthy heart lifestyle. And that's, the basics that, again, most people know but don't always keep up with. But exercise, good diet, stop your bad habits like smoking, see your doctors regularly, make sure you're on a lot of medications. For all that we've done with interventions, heart medicines have come so far also in the last 30 years that they're so helpful in maintaining even the people who have heart disease, maintaining a good functional lifestyle and maintaining a long life. So I think all those things add up to, a lot of cures almost, even though the disease is progressive.
So when patients come here, you talked a little bit about they have the procedure, then they're up the next day. Typically, how long are patients in the hospital, and what can they expect when they're in the hospital after open heart surgery?
Well, I have to sort of brag a little bit. Typically, they talk about 5, 6, 7 days. Because of a lot of things we do here, our average hospital stay for a bypass surgery is about 3.5, 4 days. Wow. And that's not because we're rushing patients out, because we really aren't. It's just we have a lot of protocols to get them off the breathing machine very quickly, again, get them up and walking very quickly. And most people are, asking to leave by that time, even if we want to keep them an extra day. So typically it's about national average is 5 to 7 days. We tend to have a shorter length of stay here. But you should expect to be in the hospital about 4 or 5 days.
And it's good. You want to get patients back home so they get into their normal routines and can get up and walking and taking care of themselves.
Absolutely. I always say it's 3 or 4 days in the hospital. It's about 4 to 6 weeks of just sort of taking it easy, and about 6 months to forget me. So there's a process.
I somehow think you're unforgettable. So. Well, we're really lucky to have you here with us and to be able to provide this program, cardiothoracic surgery, to our patients. As you know, we're the only cardiothoracic surgery program here in the Poconos area. So if patients do need it, we're very fortunate that you're available 24/7, 365.
Well, thank you very much. And I do want to emphasize your point, which is really critical. I couldn't do this without the team, which is really a phenomenal team from pre-op, anesthesia, intra-op, and post-op, as well as all the cardiologists that support this service.
Well, thank you very much for your time today.
Sure, thank you.
We've seen the concern in your eyes. You're scared, nervous, want to know if it's safe. The answer is yes. At LVHN, you'll see the extraordinary steps we take to get you the care you need safely. At all our facilities, you'll see temperature checks for everyone, that we sanitize every surface, and yes, you'll see that masks are required. What we look forward to seeing is relief in your eyes. Lehigh Valley Health Network. Your health deserves a partner.
Before I became president and CEO of Lehigh Valley Health Network, I was a doctor in the ER. I've pretty much seen it all, so I understand why you may be scared to go to the hospital or see your doctor because of COVID-19. I want to assure you that at LVHN you will safely get the care you need. We are taking every possible step to keep our ERs, hospitals, and doctors' offices clean and safe. So please, don't neglect your health. Take charge of it and know that at LVHN you have a partner you deserve.
Joining me now is Dr. Sheikha, who's an interventional cardiologist with Lehigh Valley Physician Group Pocono. Thank you for joining me.
Oh, you're very welcome.
And interventional cardiologist is a mouthful. So tell me a little bit about what that means and what you do here.
So interventional cardiology is a subspecialty of cardiology. And what we do is when somebody comes in with a heart attack, we're the people you call.
Oh.
Okay? So they will bring the patient into the hospital to the cath lab, and then we will do a heart catheterization, also known as an angiogram, where we will put a small wire through the vessels of the heart and open it up with balloons. And that ballooning and stenting is known as an angioplasty, and that's what requires the subspecialty training that we go through. All of the interventional cardiologists at Lehigh Valley Pocono are specialty trained, and we've all been working together for almost 15 years now.
Wow, that's a long time.
It is.
A lot of expertise that you bring.
Absolutely, and it's great to have other interventionalists in the hospital at the same time. So we always have somebody that we can go to in case we see something that's a little bit unusual to get a second opinion. It's always good to have a second opinion immediately.
Right. And you're available 24/7, so if somebody comes in anytime with a heart attack,
Yes.
the team as well as
Yes.
yourself or a colleague is available.
Yes, we've been running 24/7 for almost 15 years now. We don't go on diversion. We are available whenever anybody needs us, whether it's 2 o'clock on a Friday afternoon or midnight on Christmas night.
Well, that's comforting to
Yes.
know. So you always hear the phrase time is muscle, and that if a patient comes in, you have to get them to the cath lab in a timely manner. Tell me a little bit about why we say that and what that means and why that's so important.
Okay, why we say that is that it really is the linchpin for treating heart disease during a heart attack. Every single moment of a heart attack, there's part of the muscle that is slowly dying.
Oh.
And the amount of muscle that's dying really depends on how long it is from when you first develop those acute symptoms to when we open up that artery with those balloons and stents. So everything we can do to shorten that time is saving muscle and potentially prolonging your life. So it's very important to get this streamlined as much as possible. Lehigh Valley Pocono is great in that regard because when the program was first started almost 15 years ago, they set it up the right way. We used the best practices from around the country to determine how to set it up, meaning that all the interventionalists live within a certain time period, all of the staff live within a certain time period. We get called not when the person enters the emergency room, but often before they get here. When they call 911 and the EMS team arrives at the patient's house, they will call the hospital and they will call us directly and say, we have somebody coming in, we think it's a heart attack, and often we are there waiting at the hospital emergency room doors for the patient to come in. And that really does cut down on that time and save muscle and makes people live longer.
So what I'm hearing you say is that if somebody believes that they are having a heart attack, they should call 911, right? Not drive in, because a lot of times the ambulance providers ahead of time can alert you that this is a potential patient that has a heart attack. Is that what I'm hearing?
Absolutely. When the EMS calls us, they start a whole cascade of events at the hospital before the patient can walk in. And meanwhile, they will also be treating the individual on the way in. So they can not only treat them, not just give aspirin, but also give oxygen, do EKGs, control pain, and then bring them into the hospital where the ER docs and the cardiology group is ready and waiting for them here. And we got the lab open and ready to take them and open up that artery as quick as possible.
So the ambulance provider can do an EKG at the patient's home, and can they send it to you? And are you able to pull that up on your phone, or?
Absolutely. We have in place for several years now a system where the emergency technician can take an EKG in the field and transmit it to the hospital and talk to the ER doc literally within 30 seconds. And then that ER doc can either call the heart attack alert, or they can forward that EKG immediately to me. So I can get the EKG within 2 minutes of it being done.
Wow.
And I can talk right back to the ER doc and to the EMT in the field and tell them, you know, this is serious, and give them a little bit extra guidance on what to do, or tell them, don't worry, it's not something that's serious, and let's wait and see when you get here, and when you get here, we'll be waiting for you anyway.
Okay, great to know that we have that wonderful technology.
Yes, it's fantastic.
So if a patient does have a heart attack and they go to the cath lab and you put a stent in, what can they expect afterwards?
We do the vast majority of our cases through the wrist. I know that people have had these procedures in the past, meaning just 15 years ago or 20 years ago, they went through the leg and they had a lot of discomfort afterwards. About 90 to 95% of our procedures are now done through the wrist, and this is a lot more comfortable, meaning that when you get the heart stent done, you're often sitting up half an hour later, and you can walk around as soon as you get to the room and feel better almost immediately, as opposed to the bad old days when we had people have a sandbag on their leg or what they called the clamp, which would clamp your leg onto the bed to make sure that there was no bleeding issues. But more importantly is that because we have such a streamlined approach to opening up the artery, they get out of the hospital much faster than they used to, even just 5 or 10 years ago, and that they feel better much faster as well, and hopefully have a lot less sequela of the heart attack later on in life, which is more important even than that.
What about cardiac rehab? Does that play a role after a heart attack?
Cardiac rehab is fantastic, and it plays a great role. I recommend it to all of our patients, not just after a heart attack, but after the surgeries that Dr. Fuzeshi and his partner, Dr. Anderson, do. It is a gym. It's a gym on the second floor of the hospital, right down the hall from the cath lab and right down the hall from our heart surgeon's office. And it's supervised by exercise physiologists and nurses.
Right.
And they will help people get back to doing everything they were doing before, or hopefully even more.
That's wonderful.
Our patients love it. We've had patients that have stayed on and use it as a regular gym membership many years, even more than a decade later.
Well, you get to know a group of people, and there's a lot of
Absolutely.
cohesion and support for each other.
Yes, and it gives the patients peace of mind to know that if they run into a problem, which is very, very rare, but if they run into a problem, there are people there that know how to deal with it, And if there's something that they're a little bit concerned about, either after a heart catheterization and stent or after a heart surgery, Dr. Fazeshi's office is right down the hall, and myself or one of my partners are in the hospital all the time that the rehab is open, so they can call us and we will come over right then and there and see them immediately.
So it's really comforting for me to know that we have so many years of experience and such dedicated providers and a great team that can care for our community and take care of our complex interventional cardiology needs.
We have a fantastic team that's been working together. The interventionalists have been on staff at Lehigh Valley Pocono. I'm the one that's been on staff the least, and I've been on staff for almost 14 years now.
Wow.
And our staff in the cath lab has also been dedicated and hardworking. Most of them have been there since I've been there, and most of them from the beginning, 14, 15 years ago. And the rest have been on for several years now, and we are a well-oiled machine.
And we're accredited as an acute chest pain center as well, so.
Well, that's very important as well, because often heart attacks are something that are fairly quickly dealt with, but occasionally we don't know till we get in there that something is much more serious. And for those serious cases, we have all the advanced therapies necessary to get success. And by that, I mean we have Impella, which is a device that we can use to assist the heart when the heart has almost given up completely. And more importantly is we have Dr. Fazeshi and his team and his partners who are literally down the hall from us. So when we need that surgical opinion, we get that surgical opinion literally within 5 minutes. We don't need to wait an hour's drive. We don't need to wait for an office visit a week or two later. That opinion is available, and often that is something that is immensely valuable and saves lives.
Well, thank you very much, Dr. Sheikha, for sharing your time, your expertise, and your talent with us in our community.
Oh, you're very welcome.
Thank you, everyone, for joining us. It's been such a pleasure speaking with our medical experts as well as hearing from our patients. Lehigh Valley Hospital Pocono is the partner that you can trust. Next month, we'll have a fresh lineup of medical professionals to provide information to you and your loved ones to help keep you healthy and safe. Stay safe, everyone, and I'll see you next month.